Almost there. Okay. Jeff, we're live.
All right.
So, hey, welcome everybody. Just wanted to kind of our second episode here with leaders here in Mesa County. And Jeff Kuhr here is Kuhr. How do you say your last name again? Kuhr. Okay, now Kuhr. Okay. So I'm live with Jeff Kuhr, and he's the director of the Mesa County Health Department. And Jeff, go ahead, and I want to let you to introduce this a little bit.
Thanks, Cody. So I'm here to talk about some COVID-19 things. It seems to be the hot topic these days. I guess I just want to let everybody know that I'm not endorsing anybody for anything. I really take these opportunities whenever they come up. In fact, I'm going to be on a show tomorrow with Representative Matt Soper doing something for the region. So any opportunity there is to answer questions and update folks on this, it's a good opportunity for me.
Awesome. Well, thanks, Jeff. So we'll start right into it. First and foremost on, I think, on everybody's mind is where are we at nationally, state level, and locally with these COVID numbers?
Well, we see all the national numbers. At the state, we're getting ready to, we're approaching 6,000 cases in the state of Colorado, which is high because I did see on the news yesterday that all the states that were at 5,000 were getting featured, and we weren't quite there yesterday, but certainly we are as of last night. And then in Mesa County, we're at 31 cases so far. And that was as of last night as well. Each night we have, we're getting to the point where we're having 3 or 4 new cases, but we have 117 pending, which is a big number. We were down to about 23 pending, but we're doing some testing that was funded. The supplies were funded by the federal folks, and so they were very involved. So our lab changed as a result of that. And so now what we found is the people we tested are getting notified before we have their results. So I suspect that we're going to have a few more positives as soon as that thing opens up as well. So we'll see.
Yeah. Hey, Jeff, so the Daily Sentinel just released an article that said Mesa County has its first COVID death. It was a student who attended Mesa County. Do you have any information on that?
I haven't read the article. I've been told about it. Actually, I was shown the headline when we were down doing our Facebook Live earlier today. So I do know that student is not a resident of Mesa County and was not in any of our hospitals. So I'm pretty sure that whole thing happened somewhere else. And what's unfortunate about that is that people are nervous about this. And, my staff had worked with the hospitals quite a few weeks ago in all of Mesa County. That belongs to the county for which that resident resides. And because I just think that information, it scares people. So I just think it's unfortunate that came out, and I would hope that we're not trying to sensationalize on this stuff in any way. And because what will happen, Cody, is people will call my hotline or they'll call our commissioners or something and to answer questions. And then when we say, well, it's not our person, then I get accused of hiding things. And so it's difficult and it's unfortunate that it happened, but we're all learning through this as well. So.
Yeah, and obviously sad to see someone pass that even has any relationship to Mesa County, but still, not necessarily someone who's living in Mesa County. So it may not even show up on the Mesa County numbers, correct?
It will not. Yes.
It will not.
Sure.
Okay.
Okay. That's right.
Okay. So Jeff, I've been looking a little bit into modeling and such like that. So as most people, I know there's a county in Washington that you are looking at that's of comparable size, demographics, and proximity, I think, to a larger city. What is that county, and why are you watching them?
It's Yakima County, Washington, and the city is Yakima, Washington. I'm watching them, and actually, I got the idea from the chief medical officer at Community Hospital because he's from Washington or had worked there previously. So he made a comment once when we were in a meeting that, there's a mountain range going through the middle of the state, and there's communities, that are similar to ours. So I went and I started looking. There's Spokane, but it's so far toward Idaho that it's not similar. And Spokane County is quite a bit bigger than Mesa County. So then I found Yakima County. It's got 250,000 people, so it's about 100,000 more. But it's there's an interstate going through it, and it's right on the other side of the mountains on an eastern slope, as you would say.
Yeah.
So I have been following them. And the things that I'm looking at there is what was their lag time from their first reported case in relation to Seattle, and then what did their how long did it take to start to build up to their peak for their epidemic curve, which we're starting to curve into our ascent right now.
Okay.
And then how many total cases, and when will they start to descend off that peak time? And it looks like they may be getting there soon. And so it's been great because, in anything that I do, I always try to find another community of comparable size because right now all we have is, out of Pennsylvania, there's a model called the Chime model, and that's what's being used nationally, but it was coming up with some really big numbers. And model in Denver or in New York City or Chicago. So I'm glad to follow Yakima, and it's been encouraging.
Okay, and you said they haven't quite hit their peak yet?
Well, they're at their peak now.
Okay.
I'm waiting for a couple days where I can start to see a descent off that peak.
Okay.
So that will give me an indication of what's our duration for our illness as well.
Okay, and so how far behind are we from Yakima? Are we a couple weeks behind them? Do you know exactly where our model is compared to them?
We are about 2 weeks behind them. So yeah, we'll see. Now we are looking at, there are some components to this. So if there were no measures in place to try to prevent this, so the social distancing piece, if no social distancing measures are in place in a community, then you get a very high peak for a very short duration. And with that comes medical surge, deaths. So the more social distancing procedures that you put in place in a community, the flatter your curve, but the duration of this illness is much longer. So it's all interesting to me. And but the idea of flattening the curve is to not put the demand on the healthcare system. So
correct. And actually, many of the conversations I had yesterday with the Department of Human Services kind of revolved not necessarily on flattening the curve, but rather the unintended or unforeseen consequences of a shutdown. And we all understand the idea of a shutdown. It's to flatten that curve, and it does ultimately elongate the period of time in which kind of COVID sticks around. And so yesterday we really talked about a lot of those unintended consequences from drug abuse to mental health issues and things like that. Does your department deal with any of that in any way, or?
Well, we do, because a lot of our efforts when we're not dealing with the pandemic is prevention in a lot of those areas. So, I'm really about treatment is a great thing, but I would rather work with the community to build whatever capacity they need in a neighborhood to prevent the need for mental health treatment. Or, by the time people are suicidal, we want to train people on the early warning signs. I think we can work with communities to get them to a place way before we need to start thinking about what are the warning signs of suicide. So yes, naturally, this is a high stress event that's going on right now. And so it's kind of an anomaly. And but I also see it as an opportunity, because we know social capital is a huge factor in preventing mental illness and we are becoming a tighter community. And I think after this is over, I think we'll be benefiting from it.
Awesome. So Governor Polis has extended his shelter-in-place order until April 26th. And I know this is very hard to predict, probably even for Polis himself. But do you think April 26th is a reasonable date that we can all expect to kind of get back out and start getting back to work?
So we're behind Denver in our date of onset of our first case, and then also, as we talked a bit ago, if we have, if we're 50-50 social distancing, which means that we've reduced our contact by approximately 50% in general, then our duration is going to be fairly long. And by April 26th, we're still going to be in this. So which is fine, because I'm certainly not asking to extend it, but I do think that I then have the responsibility to work with our community to make sure that people are still practicing social distancing without putting orders in place. So we expect it, but it'll be a challenge to us, but I think it'll be a welcome challenge. I would never try to complain about anything or to try to change what's happening with some of that stuff. I think we can control it ourselves here in Mesa County. So,
yeah, because I mean, at some point we have to make a moral judgment as to the shutdown, the lockdown is now doing more harm than opening back up the economy. And so where that moral judgment, where that point in time takes place, really nobody knows, but someone's got to make that decision. And as far as now is concerned, I think April 26th is that line that I think has been tentatively drawn in the sand.
Yep, I think so too. And if it stays there, if it gets extended, if it would have stayed at April 11th, we could have dealt with it. We have very few cases here. Now, I don't want people to think that at face value 31 cases is what we have, because I know there are a lot of people that have been infected with this that have not been tested, because 80% of the population in general who contracts this, the symptoms are non-existent or very mild. So I don't want people to think that we only have 31. However, with a few cases, maybe some of those, some of the harm that's been done with our businesses and things like that, maybe it wasn't necessary. Maybe the order was not a one size fits all for the entire state of Colorado, but it is what it is.
So based on those symptoms, I mean, we all know kind of the common symptoms of COVID are fever, cough, shortness of breath.
Mm-hmm.
People tell me that, and I start to get short of breath and I start to cough just naturally. So, I mean, I think it's human nature to think, oh my gosh, I've got COVID. At what point should people seek medical health or actually get a test?
Yeah, Cody, it's the same thing. I watched a woman on the news the other morning talking about her symptoms, and all of a sudden for the whole rest of the day, I was short of breath. And so, yeah, it's scary. The shortness of breath right now is allergy season, and I am so heavily impacted by allergies. And so I have upper chest congestion. And so really what I try to tell folks is that, so when I cough, it's to clear something in an upper respiratory. Mm-hmm. The cough that's associated with COVID is almost you have no control over that shortness of breath, and also the cough doesn't produce anything. So I think if people start feeling like, we know when we're truly coming down with something, that's when I think people should definitely seek out help. And the first thing I would recommend is, if you feel that you're there, isolate yourself immediately. Because I've had people say, well, I can't get tested, so I guess I'm going to infect everybody. Well, if you're sick, you're sick. And during influenza season, most people don't get tested, but certainly we can make a clinical diagnosis that they have influenza. And the recommendation is that you isolate yourself so you don't infect others. And so, but yes, call your physician, and with the test, if the physician diagnoses you, or if the physician says, you've definitely got the appropriate symptoms, and they meet one of the criteria of being 65 years of age and older, they have an underlying health condition, they're a medical professional or a first responder, then we can set up the test that we're doing at a facility that we take appointments for. So.
Gotcha. Hey, I've just got a couple more questions for you, and I'll let you go because I know you're extremely busy these days. But so right at the beginning, the CDC and other organizations were saying that masks were ineffective.
Mm-hmm.
And we all understand that was probably so that it could ease the supply to those who actually needed them in the healthcare industry. But now people are now those same organizations are saying that masks are highly effective. I just want to get your take on it. Should we wear masks?
We should wear masks if we're going to be in crowds. And so I think you should wear a mask if you're going to the grocery store, or if you're going to go pick food up at a restaurant on a parking lot of a trailhead that you're around other people, because the mask in this situation is really to protect others from you transmitting the disease. So my guidance, even at the very beginning, because everybody was saying quarantine for 14 days, and someone that's been affected or high risk area, then self-monitor, and at the first sign of infection or first sign of symptoms, pull yourself out. Now the research is saying that people are transmitting this disease with no symptoms or pre-symptoms. And so the whole mask thing has come about because of that, because there are people that are infectious with no symptoms. And so the mask covers your face and prevents you from breathing out the virus or sneezing the virus, even though sneezing isn't one of the symptoms. If you have no symptoms and you sneeze, you're actually shooting the virus out. So,
Gotcha.
So that's what that's all about.
So obviously we live in Western Colorado, and most people don't like to be told what to do.
Yeah.
So obviously me and my family, we love to hike Mount Garfield, and we love to take our bikes out to Lunch Loop.
Yep.
What do you recommend? I mean, because obviously being outside is a good thing.
Yep.
Still getting an exercise is a good thing.
Mm-hmm.
What is your recommendation in terms of going to such public areas? Should we continue to do so and do so exercising safe practice, or what?
Yes, absolutely. I think you should continue to do it. Just because a parking lot's crowded with cars doesn't mean that naturally leads to a congregation of people. People are doing a great job. They drive in, they get their parking spot, they get out, and they go do their thing. What you want to avoid is getting around people, heavy groups on a trail somewhere or in a parking lot afterwards. And it's almost taken care of itself, because so many people are practicing social distancing that the new social norm is to not do what some of those folks are doing in the parking lot.
Yeah, it seems like people understand what a bubble is these days. If you walk into a restaurant or somewhere else, people keep their distance naturally now.
Yes, that's right. So I don't know. I think we have the ability to take care of ourselves in that way, and I sure wouldn't shut off those resources. So
yeah, absolutely. Well, Jeff, I won't take any more of your time. I really appreciate you getting on with me today. You need to get back to what you're doing and keep up the good work. So
thanks very much, Cody. I appreciate the opportunity.
absolutely. Have a great day, Jeff.
You too.
Bye-bye.